Welcome to EMS Office Hours. This is your Monday Minutes. I, of course, am Jim Hoffman. I want to welcome you to another episode of the EMS Quick Study resource here. We're on episode 21, and we're kind of leaving anatomy and physiology behind us. And again, a lot of the A&P sessions that we did were revolved around those key elements on A&P. So if you didn't get enough of A&P there and you still feel like you're struggling, I have a graphic below this video where you can go ahead and get some more information and some more resources to help you with anatomy and physiology if you feel that you need that. So if that's the case for you, you're still kind of struggling with A&P, go check out that resource. I think you will find it very useful. Okay, so we're going to talk about IV therapy. This is sort of a big section to cover, even though it's a quick resource and we're not going to get too deep into everything. It's still kind of big. So I've broken this up into separate parts. This is part one. And in part one, we're going to talk about a few different areas. But before we do, I want to, of course, talk to you about why it's important. And I know this is sort of repetitive if you've seen this on Monday Minutes in the past, guys. But it's important because when you go and take your exams, these key sections that I mention here are the things that you will see on EMS exams, okay, national and even regional and local exams, okay? This is basic paramedic knowledge that you need to have and that you will see on exams, okay? And it also helps you when you're thinking about how you're going to treat your patient, how you're going to document what you've done, and deciding on how to treat or even not treat your patient, and deciding on transport locations, right? So all of this ties in together, and why it's so important and why I keep doing these, because I'm hoping that you'll watch episode 1 through 20 and get an idea and kind of take home these key elements, okay? All right, so with that said, let's get into this week. IV therapy. We're going to talk about the types of therapy fluids that you can use. We're going to talk about the delivery of IV fluids, and we're going to talk about volume control a little bit as well, okay? So when we talk about the uses for starting IVs on patients, right? Patients who have some sort of cardiac issue, because we're going to be giving drugs to these patients, right? And we might need IV access for some reason. Patients that are hypoglycemic or even hyperglycemic, you want to go ahead and get IV access. And also for patients who might have seizures or are in shock, right? All these patients, you're going to consider starting an IV and getting IV access and starting IV therapy for them, right? There are, of course, many, many more reasons why you might start an IV on a patient. This is just a little handful here, okay? But this is the main uses why we would do IV therapy. And of course, we're going to use IV therapy as well if we're going to give medications via IV. And sometimes we'll even do it in a precautionary measure, sort of that critical care, right, on elderly patients or patients with extensive histories, okay, who you might anticipate giving a drug or anticipate giving food or anticipate the emergency room doing something that you can't do in the field, but they'll need IV access for their interventions, right? All of that stuff is important. All these things why we use IV therapy, okay? Now, there are 4 types of fluid that is used for IVs. Crystalloids, of course, is the one that we will use in the field. These are those salts and the sugars that are dissolved in water or normal saline, right? They cross that cell membrane. And something that you will see on exams here is that whole how many liters of crystalloid are you going to need for a liter of blood that's lost. So you're going to give 3 liters for every liter of blood, so the 3-to-1 ratio. Keep that in mind. That is something you probably will see on an exam. And then we have the colloids, and now those are pretty expensive. You got to keep them refrigerated. You don't really give these in the field. Maybe air medical teams might give that in the field, okay? Or if you're assigned some sort of a treatment area, where it's a non-transport type location that might be available to you, okay? But we don't really use colloids, but these are those ones that they really stay in that intravascular space a lot longer, okay, and not as much as needed when it comes to that 3-to-1 ratio, okay, because they're volume expanders, okay? The other two, of course, is blood. We rarely see this in the field. We might, depending upon your location and your policies and procedures, or again, if maybe you're in a air medical sort of situation where you might transport a patient with blood hanging, right? You're not going to carry the blood on the helicopter, but you might transport a patient who's on some sort of blood transfusion. But again, you have to be typed for this. It needs refrigeration. There's a special filter, right? So this is really reserved for that hospital, especially when we talk about trauma, okay? And then the fourth one is fluids that carry oxygen. Okay, so these are the common 4 types of fluid you're going to see. Keep these in mind. You're going to see these on the exam, especially when it comes to crystalloids and colloids. Okay? You'll see this on test, guys. Trust me. All right. Now, let's talk about the administration set a little bit. And we're talking about that micro or macro sets, right? Micro being 60 drops per ml, or the macro is 10, 15, or 20 drops, okay, per ml on that as well, okay? Normally, the length of the administration set, 70 to 110 inches long, depending upon your manufacturer and what your company buys and what they feel you need out in the field. You've got that piercing spike on the end of it, right? Usually it's white, and that's what goes into the IV bag. Very important to use aseptic technique when you are piercing the bag, right? And of course, be careful because it is very sharp, just like a needle, and you can actually stick yourself with that piercing spike, even though it's plastic. Okay, you've got the flow clamp, which is a roller, or maybe even be some sort of a pinching clamp, which controls the amount of fluid that's going in, right? And of course, you've got a little chamber there, like I mentioned before, the micro, macro drips, and you're going to fill that chamber up with fluid as well, and then that's going to go into your flow clamp. And this is that roller where we can turn it off, turn it on, put it down to a drip rate, okay? Then we have the drug administration port, which is the other port you'll see when you're piercing the bag. There's another port there. It's more of a rubbery sort of type of a port. It's pretty obvious that it's used for injecting medications in there. And you're going to want to clean that, guys, with alcohol. Again, using the aseptic technique before you start injecting drugs into that drug administration port. Okay? And then you've got a connector end. And this is the part that goes into the IV catheter, the part that's in the patient, the IV catheter, the IV hub that's inside the patient, okay? And that goes into the patient, and then the patient gets the IV therapy, whether it's drug or just fluid volume, in through that connector end, okay? Again, keep that end clean. There's got a cap on it. Don't take the cap off until you are ready to attach it to the hub of the catheter, okay? This way it stays clean, okay? All right. Lastly, for today, we're going to talk about volume control, and primarily what I want to talk about is that burette set, right? That is normally for pediatric patients, but we can use it for things like mag sulfate. We can use it for certain drugs that you're only going to mix it, let's say, with 100, 150 mLs. You can use this burette set because it's a big chamber. It's got those measuring lines where you can measure the amount of fluid and drug you're putting into that. And this is very useful when you're giving those specified amounts that you want to administer to a patient, usually over a pretty quick amount of time. And again, it fills about 100 to 150 mLs of fluid will fit into that burette set. Okay, and that can control the volume. Again, when you're gonna give somebody certain drugs where you're not going to be mixing it with 250 or 500 mLs of fluid, you only want to mix it with 100 or 150, you can sort of use this as a go-between, Okay. All right. So that's it for today. Again, I'm trying to break these down in sections that make sense. Next time, we're going to talk about catheters. We're going to talk about the gauges of the catheter, the gauges of the needle, and we're going to talk about the infusion devices as well. Okay. So that comes up on next time. I hope you can use these Monday Minutes. Like I said, guys, this is key stuff you can see on tests, right? You have some confusion of what I'm talking about, not sure where I'm landing on some of the content here. Go ahead and crack open your textbook, search out these sections, use the internet if you want to, or use something like, of course, TurboMedic, where you can go ahead and search the information on TurboMedic and get the answers to the questions there as well. Okay? But again, these are short videos. They're designed to give you the key points when it comes to taking your test and treating patients, and sort of hopefully ringing those bells of stuff that you already know, you might have already gone through, but this is the type of stuff to kind of really hammer home that content, and if you don't remember it, hopefully it's going to motivate you to go and seek out the answers. Okay? All right, so that's it for me, guys. As always, I always mention the EMS Quick Study Guide because this really is a great resource that you can use to help on your study and training. Go ahead and click here for details, and you can get some more information about what this whole study guide is about and claim it for your EMS library and increase your knowledge, guys, and really use this as a really valuable resource when it comes to preparing for exams and for that last minute sort of brush up before you take your test. I'll go check that out. So if you have any Monday Minutes of your own, be sure to send them over to me. I love to go ahead and create podcasts and Monday Minutes and products and services and resources based on what you, the member, suggest to me. So send them to me. My email is contact@emsofficehours.com. I encourage you to please leave a comment below and let me know what you think about this, whether you're watching this on YouTube or you're watching this on the blog. Please go ahead and let me know what you think about these quick videos, and if you like them, don't like them, or what you might want to see more or less of. Okay? All right, that's it for me, guys. Until next week, as always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.